530 News.
I'm Casey Conlon. The Billings Livestock Commission will hold an all-class cattle sale this Thursday, but this one is special, with proceeds going toward an uncurable disease, although hopefully not for much longer.
I'm Mitch Laggy. The Billings Public Schools recorded 117 new COVID cases in students and staff last week. I'll bring you details coming up.
Good evening and thanks for joining us on this Wednesday. I'm Russ Riesinger. We'll have those stories in a minute, but first tonight. As COVID cases climb, our local hospitals are filling up. Those numbers: 127 patients, 37 in ICU, and 29 on ventilators. As a result, Billings Clinic announced today that it is preparing for crisis standards of care. That means some tough decisions about which patients will be treated first and how limited resources will be used. Q2's Janelle Slade has more.
Our ICU is at 150% capacity.
Emergency room physician Dr. Nathan Allen says the number of COVID-related patients has nearly doubled in the last 2 weeks.
And we've been in a constant process as the hospital of opening up a new overflow unit, which is then filled, and then a new overflow unit, which is filled.
Physical ICU is 28 beds. It's at capacity, so we've had to surge our ICU level patients into other areas of the hospital.
Here's a great example. We're now in the emergency department where 14 of the 36 beds are full of patients waiting for other rooms in the hospital.
Our staff have been amazing, but they are exhausted. They're taking care of patients that they have not specifically trained to care for. They're providing exceptional care, but many of us have been pushed way outside of our comfort zones.
And that is why Billings Clinic is now moving toward crisis standards of care.
This does mean the possibility of making difficult choices. It does mean that we might not always be able to deliver the same standard of care that we normally would to all patients.
Allen is one of the only healthcare ethics consultants in the state and says the framework used by Billings Clinic was created statewide and has been endorsed by both the current and past governors.
We're putting in place processes to, if we have to make those incredibly difficult decisions, we're prepared to do that in an equitable, non-discriminatory, fair, and consistent way.
The clinic will likely start implementing crisis standards within a week or so.
This can include choices of which of this number of patients is able to get the highest level of care, the best chance at survival. But it's about many, many, many smaller choices before we get to that point.
And in the meantime, to avoid reaching that point, Allen says the rest of the community can help. By
getting vaccinated as soon as they can, by wearing their mask, by quarantining if they're infected or otherwise. And that's a sacrifice that people make, but it's a sacrifice that can benefit the health of everyone in our community.
In Billings, Janelle Slade, MTN News.
To address the high volume of patients and the strain it's putting on the hospital, the Billings Clinic plans to expand COVID-19 testing and antibody treatment capabilities, create additional temporary triage space in or near the emergency department, work to bring in additional temporary staff and National Guard resources to help ease the burden on care teams, open additional overflow space for more patients, and dedicate additional units to care only for COVID-19 positive patients. Well, the crisis is not confined to Billings as cases are exploding all over the state. Montana reported nearly 1,200 new cases today, with the active case total now approaching 8,700. Yellowstone County saw the most new cases with 251, nearly 100 more than any other county. The state also saw 11 deaths in the last 24 hours, including 3 from Yellowstone County, while 364 patients remain in the hospital tonight.
Billings Clinic has once again enlisted the help of the Montana National Guard to help assist with their rising number of ICU patients.
They'll be helping us with what we call proning of patients. They'll also be assisting with non-clinical duties. The last time the Guard was here with us, they seamlessly integrated with our team. It was like they were part of our team for always, and we're looking forward again to that. I think each day is a new need, and they do a great job of being flexible and redirecting for whatever the needs are that day and that shift, depending on what our patient's population is.
ICU capacity at Billings Clinic is at 150%, and they've been experiencing staffing issues, which led to the decision of them asking for the National Guard's help.
Being all Montana residents, we're here to help our fellow neighbors here in Montana. Very valuable for me to be part of that, and more reason for me to jump on this opportunity for a second time to continue to provide that support.
There are 10 members of the National Guard who will be assisting at Billings Clinic, working 12-hour shifts for 14 straight days. Once that time is complete, the hospital hopes to bring in another set of troops.
Being in the medical field, I understand the limitations that they're experiencing, and I see the hardship that they're experiencing, and I know that I'm able to show up and provide that additional support and feel like I'm a valued member of the team, which is why I decided to continue with it.
Billings Clinic says they will keep asking for assistance as long as they feel it's needed. In Billings, Brandon Warren, MTN News.
Looking back on last week, the Billings schools reported 117 new COVID-19 cases among students and staff. The data, self-reported to the district by parents and staff, shows that last week, the elementary and high schools both saw 47 new cases in students and staff. The 6 middle schools also saw new cases in students and staff last week, with a total of 23. For the school year so far, there have been 292 student and staff COVID cases in the Billings schools. On Tuesday, due to a high number of positive COVID tests, the school district announced that it would halt classes for the remainder of the week at Rimrock Learning Center, which offers preschool and caters to kids with special needs. This is the first complete building closure seen in School District 2 since the pandemic first began in 2020. As the positive cases continue to trickle in, Billings mother Wendy Rivera said Wednesday that she's nervous but will still send her kids to school. Her first grader Shayla was homeschooled for a portion of last year, but the family is too busy this year to take up the heavy task again.
I tried for like 3 months and I just ended up like in a dead end, I can't handle it, and she wants to go to school so bad too. She loves going to school. It's something that worries everyone. Of course, it makes me feel so worried about her, but at this point, I think the only thing we can do is just pray for our kids. Because nobody is safe at this point, nobody is safe, COVID is around everyone.
Rivera wanted to express her thanks for the hard work of all teachers in Billings. Reporting in Billings, Mitch Laggy, MTN News.
Chief Meteorologist Ed McIntosh joining us now. Warm and windy conditions today. Unfortunately, that means greater fire risk.
Yeah, especially when you combine it with the low humidity. Take a look at the big area under a red flag warning, meaning the fire conditions are really primed all across eastern Montana, much of northern Wyoming, southern Montana as well. So today we're seeing the winds kicking up 30, 40, 45 miles an hour in some cases. Very warm temperatures, in fact, approaching a few record highs over that widespread area with the low humidity that's down into the teens and 20s. So that means use a lot of care. The chains, both on your trailer, the chainsaws and sparks, and smoke and flames in general. We'll come back and take a look at the forecast details. A lot of changes day by day coming up.
Still to come on your MTN 530 News here on Q2, a local boy is facing a rare disease, one that needs more research to find a cure. How the Billings Livestock Commission hopes to help.
The MTN 530 News continues right after this.